Hello, good afternoon. Well, almost afternoon. This is my 7th outcome reflection video. I'm almost at the end. I'm actually shocked and I cannot believe how close I am. So next week is the last week. I'm super excited. Clinical went great, but I already did clinical on week 4, so that turned out great. Class is good, but then it's still a little stressful because at the end you're trying to get everything in as fast as possible and as done and concise as possible. So this is like my second to last outcome video that I'm going to do, and this week I'm going to talk about written communication. So back in 250, I had a client that came in with a different diagnosis. This person was severely, well, I want to say severely anemic, right? So they're anemic and they were taking Epuitin, I cannot pronounce it right, for their red blood cells. So they, when a client is admitted to a hospital, it's routine for patients, for staff to do, and doctors to order labs, and then we get the labs done as staff. So they found in this patient's labs that they had low potassium level, so they had to get IV potassium. So that was the written order that I was seen. So when I saw that, I reported that to my instructor at the time, and I let her know this is the written order that the doctor put. These were the labs that were presented when they did the labs for this patient this morning. So with that said, I'm not able to hang the IV unless I'm doing it with my clinical instructor. So we worked on getting that done for the patient. So we assisted with the primary nurse in doing that, hanging the potassium in as the IV piggyback, and they already had almost daily running, or rather sodium chloride running. So we did that as well, and then we waited the next day to see if the labs had changed. So the potassium level did increase the next day, and it was reported to the doctor. I would do that again once again. There's a written communication, meaning there's new orders. We as nurses are supposed to implement that, and we have to look at, but before that's done, before it's implemented, we have to look at labs, the vitals, what's the current situation before we communicate that back, and then report to the provider if we have to question it. So we didn't have to question. Of course, sorry, I'm stumbling my words. So of course, no question that the potassium had to be prescribed because it's low level, and a normal potassium, it's between 3.5 to 5. This patient's potassium was 3 something, and luckily this patient did not because this patient was at risk for arrhythmias, and that's when the cardiac rhythm is completely out of control. And we're just lucky that the patient was stable and fine, but she ran a risk, so hence why the potassium had to be administered. So would I do anything differently? Not really, because based off that lab, she needed that medication. And that's the thing, as a nurse, you always have to follow that instinct, and always look at what your labs are, your vitals, before you look at written communication, which again, that's the new order, and see if that needs to be implemented. So I will become a better nurse because of that. I am already a good nurse, and I'm close to the end. So thank you so much for listening, and have a good day. Bye.